Good morning, students. Today we will see about the Peplau's interpersonal relation theory. Her name is Hildegard Peplau. She is a psychiatric nurse. She is known as a mother of psychiatric nursing. She born in 1909, Pennsylvania. She did the School of Nursing in 1931 and 1943 she has done her bachelor degree. 1947 she has done a MA in psychology nursing. 1950 to 1970 she worked as a clinical nurse specialist. So all his experience made her to develop this theory. She is a psychiatric nurse, she is an expert, she is an educator, she is an author, she is a nursing leader and also the nurse theorist. Okay, so she told that the Peplau interpersonal theory. So interpersonal nursing theory, she is talking about the good interpersonal relationship will be reducing the patient's illness. That's what she is meaning that. And she stated that the nurse and the patients are both like strangers. They do not know each other. The nurse is a different person and patient is a different person. She has her own values, culture, belief, past, preconceived ideas of anyone. Patient also will be having a value, culture, belief and experience, everything. For example, you think that I worked in Saudi Arabia. I am a nurse. So I come from another nation, another nationality I am. My patient is coming. My value is different and my patient values are different. He may have a preconceived idea about who I am, how I am. And I also have some experience about how he will be dealing. So both of us are meeting each other. So she is talking systematic steps to make an interpersonal relationship. First she is talking about orient with each other. Who are you, like that. Then once you orient with each other, with this communication will be helpful to identify each other. This identification means identify the role of each other. You can identify. And here once you identify what is your need, your expectations will be understood by each other. Then this is the phase you can do the care, exploration and everything and the resolution. Resolution, this is like a therapeutic relationship process. So she is talking about the nurses should be always must focus on the therapeutic relationship. This therapeutic relationship will be help to solve the problems and helps to collaboratively meeting the needs of the patients. And the Peplau is very particular about the communications. So what is the communication? She is talking about the nurse should be a very good communicator and very good observer, because she is telling the patient may communicate to you verbally as well as the non-verbally. What is the verbal communication? Maybe she will click or the bell and call the nurses. Sometimes non-verbal communication. Maybe she is telling her, look at her eyes, look at her, look how she is looking with a very sorrow, with the depression she is sitting. So the nurse has to understand her communication, either the verbal or non-verbal. So this is she's talking about the reaction and the response. So the patient action may be a verbal as well as the non-verbal. So nurse should be a response. How the nurse response should be? The nurse response should be according to the patient's reaction. It should be dynamic and it should be very deliberate and it should be very automatic and it should be immediate. How it is going to be? For example, the nurse is walking in the corridor. Suddenly it happened for her to turn and see the room. You could see the person is putting the hand in the abdomen and with very sad he is sitting. Immediately you saw the person's action is little bit something wrong. He is not communicate to you verbally, but you could understand the non-verbal communication through the gestures. What is your reaction? The nurse has to deliberately enter. Hi, what happened to you? May I help you? Why are you looking very sad? So you have to ask deliberately. It should come very automatic. It should be dynamic. I am telling one person is example. The another person may be a different. right or not? So, and it should be immediate, and okay, I will help you for that, you can overcome that. So the nursing action should be very automatic nursing process, and it should be unique the patient's need, and it should be activities should be arranged in a sequence manner, and the nursing process, you can deliberate nursing process you can follow. That deliberate nursing process will be unique to the each individual. How these nursing reactions, your perception, your thoughts and your feelings, so that should be a nurse has to understand what you perceive, what the person may think that. So your nursing actions will be improve the patient's behavior. With the collaboration strategy, you both are developing the trust with each other. They will try to believe with each other. So this system will be response. So the patients will be showing the positive behavior. So she is a very good psychiatric nurse, and she is only the person means not a family or this one. She is only specifically telling about the person means it is an individual. The individual is like you have to make the individual with a therapeutic relationship. So this therapeutic relationship will be helpful for him. So she never defined anywhere there is a family or this one. And when you take the meta paradigm, the environment is also she did not define in very specifically. So she is not telling very specifically. If you see the meta paradigm, the nursing is like a significant therapeutic interpersonal process. It focuses on the corporate and collaborative action. So how it should be? It should be in a felt need of the individual. It will be like a felt need. It should be deliberative. It should be collaborate. You have to follow the sequence steps and deliberate nursing process, therapeutic, and using the problem solving technique. You have to collect the data, communicate the data, record the tool. So the nursing should be according to that. You have to follow. So she is stressing so much. This therapeutic relationship will be helpful you to communicate with each other, understand the patient's action and your reaction, and your action should be immediate and deliberate and automatic. And about the persons, as I told you, she is defined as an individual, not a family or group or other things. She is not talking like a petty human. And the environment also, she is not specifically defined the environment. Nurse must consider the culture and value and belief and about this. And nurse must understand the patient enter into the different environment. He came from the another cultural environment. So you have to make him comfortable and not address any possible environmental influence, like how the Petinim is addressing and like the stressors is talking about it. She is not talking about that. She is mainly focusing on the good interpersonal relationship will be reducing. Health, she is like talking about the forward movement of the personality, ongoing human process towards the create and constructs protectively, personally, and interacting the like promoting interpersonal process that will make them to do the work properly. So she is mainly focusing upon the interpersonal relationship. This interpersonal relationship, she is also telling a sequence steps: orientation, identification, exploration, and resolution. So the therapeutic relationship will be ending in the resolution. So the both nurse and each others or the strangers, they are meeting with each other. The nurse has to follow these steps and identify each other, get the trust with each other, so that they can follow the collaborative deliberate solving method. Nurse has to given much important about the verbal and non-verbal communication, and this verbal communication, to understand, she should have a good perception and perceiving power and identify the thoughts, and every individual is unique. So whatever her activity, it should be deliberate nursing process, but though it is deliberate, it should be dynamic, deliberate, automatic, and immediate response. That way of doing all these things deliberately, automatically, follow the systemic process, half of the individual's problem will be solved. Understand? So this theory you can also apply, like it's also like a psychodynamic theory. For example, if you are taking some of the studies related to the self-esteem, how you are improving, and then psychological related studies, you can apply this theory process in your MSc thesis. Okay, thank you. Next theory I will meet you.